I think the first thing is caregivers need to be aware of what are the consequences psychologically and physiologically if I'm not coping well. And what does that mean? First of all, what does it mean to cope? And to cope well means that you have flexibility in your problem solving, that you have an optimistic or positive outlook on what may or may not happen, that you know how to access resources and how to use those resources. And signs and symptoms of poor coping, which tend to be along the lines of denial, like I can't believe this is happening to us. If I just pretend it's not happening, it will go away. I think we'll pray for a miracle. Not talking to friends and family or a close confidant about how you're truly feeling. All of those are indicative of what we would consider kind of poor coping, which then results in sleep disturbance, being distracted. They're both cognitive and behavioral indicators of poor coping. Those are just some examples. Some additional ones would be change in appetite, being irritable, being short-tempered. Of course, increased depression and anxiety. But the first thing is you have to be capable of acknowledging that those things are happening, or have a care provider who can help to point those out to you. So some good coping strategies are allowing yourself some time to take care of yourself. And mothers often will laugh at me like, right, when am I going to find time to do that? But it's critical that either you find someone you trust to watch your child, or your partner lets you go for a night out or go for a run or belong to the gym. So those self-care behaviors. And if they're in place prior to the illness, they're most likely going to be rediscovered and found after the fact. If the caregiver's never engaged in those activities in the first place, it's going to be a little tricky. But self-care is essential, and acknowledging and knowing that it's, your child's only as good as you are. So if you're not coping well, if you're not psychologically sound and making good decisions, then your child will suffer.